for us. And I want to talk about how the foundation assists in the creation of dependency, coupled with the attenuation of democracy. The Foundation's emphasis on single-issue, vertically organized interventions tends to undermine community-based primary care, which was endorsed by the Alma Ata Declaration in 1978 as the model for third world public health programs. This was based implicitly on the Barefoot Doctor program that revolutionized public health in the People's Republic of China. And the philosophy of primary care proposed that people have a right and duty to participate individually and collectively in the planning and implementation of their health care. Today, however, primary care programs worldwide are on the decline due both to the imperatives of structural adjustment programs and to the meddling of U.S.-based foundations. And I'll give you a quick example of how it is that the Gates Foundation undermines primary care. We look at the Gates Foundation approach to diarrhea, which kills upwards of 1 million infants annually. The procedures necessary to control diarrhea are not mysterious. Clean water and adequate sanitations are essential to prevention. Treatment consists in administering oral rehydration salts and zinc supplements to afflicted infants at the local level. And in fact, the Chinese barefoot doctors achieved steep declines in diarrhea mortality from the 50s through the 80s by distributing oral rehydration salts at the village level and educating families on their importance and proper use. Yet, while shepherding governments away from investing in the sanitation infrastructure and primary care that have been proven to save lives, the Gates Foundation funds and promotes vaccine research, marketing programs administered by NGOs, and, quote, working with manufacturers and distributors to make ORS and zinc products more attractive to consumers by improving flavors and repackaging products. This, needless to say, was something I found particularly appalling, the idea that somehow the women of the global South could not be trusted to wish to save the lives of their own children unless oral rehydration salts were packaged and marketed to them like Coca-Cola. Charitable activities that undermine democracy and state sovereignty are frankly immensely useful to the ruling class. Robust, effective social programs in developing countries are an impediment to the current imperial agenda of worldwide expropriation. Healthy people in control of their own destinies and invested in the social well-being of their communities are better equipped to defend their claim to the wealth that they possess and produce. Far better from the point of view of the philanthrocapitalists like Bill Gates, if the world's poorest billions remain wholly dependent on a largesse that may be granted or withdrawn at pleasure. So what I'd like to do now is turn things over to Kwame Fosu, and I have lost my piece of paper where I wrote down your intro. So would you be willing to do it yourself?
Yeah.
I'm delighted that Kwame Fosu could be here today, and take it away.
Okay. Good afternoon.
Here it is. Allow me. Kwame Fosu Shabazz is CFO and Policy Director of the Rebecca Project. The Rebecca Project's immediate goal in Africa is to seek a permanent solution with the backing of international law enforcement and a coalition of concerned foundations to halt illegal human subject research in Africa and to stop the fabrication of data. Dr. Fosu is author of the groundbreaking and excellent report, Depo Provera, Deadly Reproductive Violence Against Women. Prior to working with the Rebecca Project, Kwame Fosu worked briefly with the Public Defender's Services in Washington, D.C., and also served as a legislative fellow for Representative Charles Rangel, where he addressed issues related to crime, foreign affairs in Africa and the Middle East, and AIDS, HIV in Africa. Kwame Fosu developed the Rebecca Project's Educating Girls to Empower Girls, the EG Squared Initiative, and the Summer Leadership and Mentoring Program for Teen Girls. He is also a board member of AEH-LIHD, African Education, Health, and Law Institute for Human Development. He founded ResearchLeaks.org, a cyber office of research integrity, a necessary and efficient tool for research whistleblowers in remote parts of the world, especially in Africa, where research integrity monitoring is virtually non-existent. Dr. Fosu received his BA in Criminal Justice, magna cum laude, from the John Jay College, CUNY. So he's come back to his alma mater, an MBA from Pace, and a JD from Georgetown University Law Center. So take it away, Dr. Fosu.
So I work for the Rebecca Project for Human Rights. I'm the policy director of International Health. And the Rebecca Project is a transformative women's rights organization. And when I say transformative, what we do is we identify an issue, we advocate through a grassroots movement to change policy, to protect women from different types of laws, whether it's health, criminal justice, or sex trafficking. These are the issues that we've been working on. This brings me to Depo-Provera. How many here know about Depo-Provera? Show of hands. Okay. So Depo-Provera is an injectable contraceptive. It is about 99% effective. It is also called the DDT of contraceptives. The reason why it's called the DDT of contraceptives is because as DDT was very effective as a pesticide, it ruined the earth. It poisoned, the waterbeds, it poisoned fish, it killed plants, and eventually DDT was banned in the United States. After DDT was banned in the United States, it was sent over to Africa for African farmers to use. And the same thing is happening with Depo-Provera. Depo-Provera is a progesterone contraceptive that's injected into women, and every 3 months you go for a shot. It is a choice contraceptive for, I'll say, population control activists, like the Gates Foundation, the Population Council, and also Planned Parenthood, because it's an effective way to stop births of low-income women, of women who are of color, usually blacks, and Latinas. And also, Norplant is a contraceptive that is implanted under your skin every 5 years. Norplant and DDT have the same chemical constitution, except Depo-Provera is a shot, and Norplant just is implanted. And every 5 years, you change the implant. Norplant was banned in the United States in 2002. After it was banned, what the Population Council did was they licensed Norplant to the Bayer Corporation. The Bayer Corporation is located in Germany. They licensed it to Bayer Corporation, and the Bill and Melinda Gates funded the use of Norplant in Africa, and also in the Caribbean and South America. This is what they did. So I thought I was pretty sophisticated with policy. I worked for Congressman Charlie Rangel, as all of you may know if you're from New York, and I was working on AIDS issues, working on a variety of issues for Africa, foreign affairs, and I had never heard of Depo-Provera. If you're in a certain socioeconomic group or class, you just never hear of Depo-Provera. So I never fault anyone who has never heard of it. I was sitting in my office in Washington, D.C., and I got a call from a lady who went to Columbia University. This is my introduction to Depo-Provera. She was an MPH from Columbia University, really brilliant woman, and was hired by Columbia University's professor. His name was Dr. James Phillips. She was hired as a program manager to go to Ghana to oversee an experiment they called MOTEC. The MOTEC experiment was funded by the Gates Foundation in alliance with Columbia University. So she went up there, and while they were about to release their first newsletter, which the program officer is in charge of, her former professor, Dr. James Phillips, who is a really well-known reproductive health researcher. If you Google him, he's done research for over, I think, 40 years in Africa and in South Asia. He basically told her to conceal certain evidence from the newsletter, and she refused. And she said she cannot ethically do that. It will not be right. And she started receiving pressure from different levels in the research hierarchy for her to conceal certain evidence or change it or minimize it. And she said she will not do it. She was finally fired. She was finally fired by Kwame University. This was in 2010. So she went to the media about this, and she was interviewed on television and radio in Ghana. And as she was being interviewed, she started receiving calls because they put out her phone number and email. She received calls from doctors who had worked with this researcher called Dr. James Phillips. One of the doctors who called her worked for Johns Hopkins University, the Bloomberg School of Public Health. Called her and said, I worked with Dr. James Phillips on a previous experiment called the Navarongo experiment. The Navarongo experiment is a seminal reproductive health experiment that tested the efficacy of Depo-Provera. And what Dr. James Phillips designed while he was working for the Population Council was an experiment that was disguised. Jacob was talking about this. They disguise experiments as routine health care. So what Dr. James Phillips did was he was testing Depo-Provera and disguised it as routine health care for the poorest, impoverished people in Ghana in the northern region. It's mostly Muslim populated, very poor people. They earn probably about $1 a day if you think about their earnings. And he tested Depo-Provera on them between, this was around 1999 to about 2006. It was called the Navarongo experiment. In the Navarongo experiment, they did not get informed consent. Informed consent forms give human subjects basically authorize researchers to basically test different products of them or take their information. And what Dr. James Phillips did is he refused to give them informed consent forms and injected close to about 9,000 women with Depo-Provera, testing the efficacy. Not only did he not give them informed consent forms, but he fabricated the data that was used in the final reports that were published by the Population Council, by the United Nations, and also in several reports with the U.S. government, USAID, that also sponsored this experiment called the Navarongo experiment, and also, of course, the perennial sponsor, the Gates Foundation. So the Gates Foundation was a major sponsor of the Navarongo experiment. So when I got hold of this information, I became a public health student, and I went to work. I called different experts and insiders from Lancet Medical Journal, insiders from the United Nations, insiders from the CDC, all started giving me information, and I learned a lot. What I learned was that the Gates Foundation, with NIH, had paid for research, a researcher called Renee Heffron. If you can write her name down. Renee Heffron was a preeminent researcher from Seattle, where the Gates Foundation is. And in 2011, she was funded by Gates and NIH to perform an experiment to test the efficacy of Depo-Provera and progesterone injectables. Her results were contrary to what Gates wanted. She said, no, this is a dangerous contraceptive, and it increases the risk of HIV infections. So it definitely should not be used in Africa, and it should not be used in communities that are at risk of high HIV infections. So what Gates did was immediately he attacked her. He tried to discredit Renee Heffron. This is how the foundations operate. So if you don't give them results that are basically in line with their policies, their set policies, they attack them. Renee Heffron was defended by other preeminent researchers, and I got hold of the information through a researcher who's in Africa, who works for the United Nations. These are confidential sources. Sent me the documents, and I published a lot of this research. I called the Gates Foundation, and I got a return call from Connie Collingsworth. Connie Collingsworth, this is the difference. This is what the Rebecca Project does. We actually make sure we resolve the issue. We don't just talk about it. We will basically identify all the players, the stakeholders who are affecting an issue, and we try to get a solution. So I called Connie Collins, she returned my call in 2010, October. So when she called me, I told her about Dr. James Phillips. I told her about Depo-Provera. I told her about what we're working on, and she was very pleasant. She said, wow, this is great. This is a serious issue in Africa. Research is a serious problem, and you're doing great work. How can we help you? How can we help you? And I said, well, this is just this is an initial investigation I'm conducting. I'm glad that you're being very receptive to this. So I'll get back to you with the help that I need. I informed the Ford Foundation, which was funding. We were being funded by the Ford Foundation. I mean, I was totally green. I didn't know what was about to hit me. So I didn't know. And here I am, being a researcher, a human rights attorney. I'm trying to do the good work, you know. So I call Gates, you know, I give her information. I call the Ford Foundation. I call everyone. I said, this is what's going on. This researcher is basically, he's unethical. I found linkages from funding from Ford, from the Gates Foundation, and I'm informing you about this. I'm just doing my due diligence. This is what I was taught. This is what you do. And I informed Ford about this, informed all our funders, the Mariah Fund in New York, the Novo Foundation, which is Buffett's kids, it's called the Novo Foundation. I inform everyone about this. And they're all very pleasant. And in 2011, in September, I released a report called The Outsourcing of Tuskegee. Basically, the Tuskegee experiment has now been outsourced to Africa. And so I called it the outsourcing of Tuskegee. It was launched at the Congressional Black Caucus Legislative Conference in Washington, D.C. by Congressman Conyers. Congressman Conyers, as chief counsel on the Judiciary Committee, is Keenan Keller. And he was very, aggressive about us launching it with Congressman Conyers to a black audience, because this is an issue where Depo-Provera, 85% of Depo-Provera is being used on black women in the United States. So we launched it. We had calls from everyone. It caused an uproar in the reproductive health community. What happened was Peter Donaldson, who is the president of the Population Council, and his general counsel, Patricia Vaughn, came to Washington, D.C. to visit Congressman Conyers after we launched this. They came over, and Keenan Keller basically spoke to them. They were very pleasant. They were very pleasant. They said, we welcome the Rebecca Project's report, and because we basically took the Population Council to task for publishing a research experiment that is basically fraudulent. And Peter Donaldson is a good man who has inherited a institution that has in the past and historically conducted very, I'll say unethical research. So he spoke to Keenan Keller and said, anyone who denies anything in our report is suspect. And he wants to do anything he can to change research in Africa. And so this was great. However, what happened was the Population Council and Planned Parenthood and other researchers are all agents of, I'll say, Pfizer, which is a manufacturer of Depo-Provera. They act as intermediaries for Pfizer Corporation. Pfizer has a system of giving foundations, health providers, different types of monetary incentives to push this drug. So even though the Population Council was very receptive to our report and wanted to make changes, what ensued was reproductive rights advocates led by Shira Sepperstein of the Mariah Fund, who is a very astute reproductive health funder. She built a coalition of all the different foundations that were funding us. She contacted the Ford Foundation. She also contacted the Novo Foundation, contacted all our different funders to defund us. This is what she did. And Keenan Keller, who works for Congressman Conyers, called me and said, I am getting information that they've also contacted your executive director. Our executive director was also implicated. They got to her. And in a few weeks, she denounced our report that she was part of publishing. Yes. They are very powerful. So denounced the report.
Who organized this again?
What?
Who organized this again?
Shira Sepperstein. Shira Sepperstein. She works for the Mariah Fund. She works for the Mariah Fund until 15 days ago, after we sent a letter to the DOJ to prosecute all those involved. She was working for them. She was forced out. So there's more to this story coming out. She's been forced out, but she's been given another cushy job.
Can you talk a little louder?
Oh, sure, yes.
That's the air conditioning.
Okay. So where was I?
A little louder, please.
Okay.
They defunded you.
Okay, so what happened was they...
You were defunded, that's
yes.
what you want, you were defunded.
Yes, they Shira Sepperstein organized for them to defund us and attack our report. Our executive director called me to the office and said, you know, the funders are unhappy. They're going to cut off funding for, and these funders who have basically been our bread and butter for the last 10 years are all unhappy. They think this report is false. And I said, what if the report is false? We have evidence, we have references, and so on and so forth. She said, just pull the report, and I refused. So she left, she resigned, they defunded us, and we had other, grassroots groups, pick up the funding for the Rebecca project. To make a long story short, is that 2 years after they defunded us, we wrote another report called Depo-Provera, Deadly Violence Against Women. In that report, we detailed all the harm of Depo-Provera. And what we realized was institutions like Planned Parenthood, institutions that were NGOs that were being funded by the Gates Foundation in Africa, were basically concealing the side effects of Depo-Provera. One of the major side effects is osteoporosis. There are black box warnings on all Depo-Provera injections. And the black box warning is the most stringent warning that states that this drug is lethal and can harm women. And also, you're not supposed to use Depo-Provera for more than 2 years. All that is being concealed from women here and in Africa. The second most important issue was the issue of HIV/AIDS. Why was Bill Gates, who had funded research about HIV, concealing this from women, especially communities here? For instance, in Washington, D.C., where I live, we have some of the highest HIV/AIDS infections comparable to Africa. So as a public policy, we should not use a drug like this that increases AIDS. I know some of you are thinking, how does Depo-Provera increase AIDS? What happens is when you take a shot of progesterone, it breaks down the vaginal epithelium. It thins it. So if you're a girl or a woman going out, young girl or woman going out to a club, to a bar, you meet a man. If you're living in South Africa, you go home with a man. The man demands, I'm not going to use condoms, has sex with you. You have a higher susceptibility to get HIV. Unlike a woman living in New York City, maybe on 59th Street, who goes to the bar, meets another gentleman who most likely does not have AIDS, has sex with a person, and doesn't contract AIDS. So as a public policy, if we're looking to protect women, we should not use contraceptives that are progesterone contraceptives like Depo-Provera. Another issue was that it doubles the risk of breast cancer. It doubles the risk of breast cancer. So the American Association for Cancer Research published a study, this was in 2010, that detailed these facts, also published by the NIH. So all the insiders in government and in politics know about the harm of Depo-Provera. And so they published the results of breast cancer, and nothing was done about it. Also, to to promote Depo-Provera in Africa, what the Gates Foundation did was this. They changed the name of Depo-Provera to Cyana Press and Interject. So because the FDA has these very stringent warnings about Depo-Provera, it has to be administered by health officials. You have to go to a clinic, and Longton's health official has to inject you with Depo-Provera. So what they did was they changed the name of Depo-Provera to Cyana Press and used community groups. So you don't have to be a health official to go door to door to different women to inject them. And imagine going to Africa or someplace in Southern Asia where a community worker, who doesn't have a high school diploma, knows nothing about health, is carrying a bag full of Depo-Provera and is given a script, this is good for you. Your husband will not know that you're taking contraceptives because you don't have to take it every day. That's the hook. That's the marketing promotion hook. Your husband will not know. You don't have to have lots of babies. So these are good things. I don't want to have babies. My husband will not know about this. Sure, inject me. What they're not telling you is that you might bleed. You might have a heart attack, and you might have strokes, and you eventually develop different types of cancers. So these are women who are they're not being given access to safe contraceptives, which is basically what the so-called reproductive rights movement should be about, access to safe contraceptives. And there are safe contraceptives. And I always talk about this, where they say, well, these are folks who are having children at a very early age, teenage pregnancy, and so on and so forth. And they say the same thing about low-income women over here. But that's all very false. When you read public health research, women in Europe, let's take the Netherlands for example, girls in the Netherlands start having sex at an earlier age with multiple partners. However, in countries like Netherlands, they have the lowest teenage unwanted pregnancies. There's so many women who've never heard of an abortion. It's completely foreign to them. And nobody in these countries use long-term contraceptives. They don't use Depo-Provera, they don't use Norplant, they don't use IUDs that are laced with progesterone. They don't use any of these long-term contraceptives. They only use low-dose contraceptives, usually like Loestrin, with a condom. It's called the double Dutch method. And it's proven to be very, yeah, it is. It's called you can Google that. It's called the double Dutch method. And you use a low-dose contraceptive and condoms. And you start teaching girls at a very early age about their reproductive health. That is what is necessary, not this type of, what I call cattle. It's like basically injecting, black women, Latinas, injecting, women from South Asia with these dangerous contraceptives without educating them because you have an agenda to lower their populations. But what is really sinister is that in Africa has enough land to absorb 5 times more of its population. There's a land grab going on in Africa by different groups that are funded by Gates that are buying out, African land. They claim that we don't have resources, but they're buying all our resources to feed the West, as Jacob was talking about.